Good morning to all the assembled delegates. I'd like to now, we heard Venkat from Dell talking about the emerging technologies and the predictive outcomes in healthcare that some of these technologies can deliver. So now we would like to hear from the horse's mouth per se, and maybe a little bit more detail about some of these emerging technologies which are being embedded in healthcare and more so in the future. For that, I'd like to welcome on stage Mr. Sugumar Umapathy, Enterprise Architect and Field CTO, India Presales team of Dell Technologies. And welcome, Sugumar.
Good morning, everyone. Is this working or that? Okay, great. Thank you. Good morning, everyone. What a wonderful session. I think quite insightful in terms of the discussion and the varied inputs that came from different delegates. So what I wanted to touch upon in this 15-20 minutes of discussion is talk about how your organization can be future ready given the trends that are happening in the industry, healthcare industry as such, and how Dell can be a partner in those areas for you. So if you look at some of the data points that we discussed from morning, most of the things were about how do we go away from a episodic care to more of a proactive or a preventive or a holistic care, right? So today if you look at technology, definitely have been helping people live longer and take care of many of the chronic diseases, but some of the statistics are a little alarming. If you look at what the stat says, average about 1 out of 3 people, adults, will be having a chronic disease throughout their life. And this is something which causes so much of burden on the health infrastructure from the care that you have to provide for a longer period of time, and the data has to be maintained for a longer period of time. The imaging and the diagnostics that happens also bring in a lot more of data that has to be managed, held securely, and also protected for a much, much longer period of time, right? So some of the new areas in which health industry has been focusing upon is on the edge. Edge is a place where the physical and the digital meet, right? So call it IoT sensors, call it virtual reality, or an augmented reality, or ability to use this sensor data to do health devices that people wear. Most of the devices that people wear these days have some or the other sensors, like from the footwear to the jackets to look at the perspiration of the individual and be able to predict advanced things which could happen, like smart watches are something which is very, very common. We've been using for quite some time, but there are many more advanced things that are happening in this area. And one thing that we are able to do today is, especially in the pandemic times, when people are walking into, for example, an airport or a large building premise, with thermal scanning, you're able to identify the body temperature of that individual, right? These are some of the things that we are able to do today, right? But much more can be done with that, and that is where industry is focusing around. Data is, I would say, is exploding today, right? Venkat gave a few numbers in terms of 900% growth in data. Just a single pathology, digital pathology for a single WSI is about a 3 gigabytes of size, one single slide, right? We are talking about storing that data for a very, very long time. X-rays, your other images that you take, CT scans, MRIs, all of them are going to cause this data explosion to be even more. But that is not where it stops. The expectation is you're able to access those data wherever you are, right? The radiologists, the clinicians, the patients, all of them want access to the data wherever they are. Now, moving this data is not easy, and one of the points that was discussed in the previous panel was how do we make them interoperate? How do we ensure that some data that is coming from one particular vendor works with another vendor? And it is easily viewable, actionable on that particular data, right? Managing data becomes very, very critical, and that is another area where a lot of focus is around. AI, I wouldn't say it is something new, but evolving. One of the examples I was talking about today with one of the doctors here was how we are able to use AI to predict or rather diagnose COVID much earlier than a swab test could do, or the 3 to 4 days worth of time that you had to wait. An X-ray, chest X-ray could reveal the early symptoms of fibrosis in a much, much faster way, instantaneously. And AI was able to do that effectively in some of the places. CMC, Chennai Metropolitan Corporation, was able to do this very actively with the van which was carrying this AI device along with the Dell equipment, and the AI solution that was able to take the X-ray and predict and say, help you in a triaging as well, if this particular patient is in a early stage or needs attention, etc., and then could be referred to a specialist, right? 5G is evolving in India. It is still, I would say, early stages, but 5G is certainly going to help bridge the care that can be provided to remote locations. Today, as most of us were talking about in the panel as well, most of the healthcare is today offered around tier 1 and tier 2 cities at max. Rural areas are not as much covered, but even there we would see 5G going to be a very, very useful solution. And with the pandemic, I would say all of this have got accelerated with telehealth capability. We are able to provide this care that you can get from a metro city right towards a very, very remote village. And there is something which we have been doing interestingly in this space about covering the rural population. We have been doing it since about 8 to 9 years in partnership with Government of India in the NCD program. So we have sort of been the technology provider and a partner for building the platform in the NCD program and addressing 5 of the critical illnesses that are the primary causes of death in the country. So cancer, hypertension, diabetes, right? So those are some of the areas in which we have been working, and we are proud to say that. And security of this data is extremely critical, because the data, as long as it is a paper, right, which was the case all this while, it has always been safe in one place. Finding it was always difficult. But today, with this information digitally available, getting in the wrong hands can create a lot more issues, right? A patient data in the wrong hands can mean that that particular data can be used to target them throughout their life, right? And in parlance, if you look at gone are the days when financial data, credit card information was the most costly, I would say, data that pirates and all the wrong hands used to pay for. But today, healthcare data is the one which they are willing to pay much more than what they were paying for other information. So today's discussion, I want to focus on 3 areas: connected healthcare, how to have data accessible anywhere and everywhere, and how do we enable this technology as a consumption rather than as a barrier for many of the organizations which are not IT focused, right? So in terms of connected healthcare, one of the topics that Mr. Naveen talked about in the beginning was how do we digitize the entire workflow within a clinic, right, or a hospital. Now, it could start from the device that the nurse carries around, or it could be the smart device that you can give to a patient, which collects the vital information as they enter into the hospital or once they are inside the hospital as an inpatient as well. And how do we track them throughout their stay within the hospital, at the same time be able to provide that information and make better use of it. So one is finding out if the right treatment has been provided, availability of, say, medicine within the pharmacy. Do we have the right inventory of it while prescribing that particular medicine onwards, right? So it could be a complete workflow that can be integrated. And what that means is you are able to access information readily, and that information is going to help you in doing and providing a better care to your patients, right? So the devices that are there can be of different personas. A front desk could have a very different requirement. Somebody who's on the move might need a rugged device. Somebody who is in the lab might need a very different kind of a category, right? So how do you help all of these different use cases help the infrastructure for those requirements? How do we take care of them, right? And how are they interconnected so that data movement, wherever you are seeing, if it's an iPad or is it on a laptop, on a mobile phone, or on a big screen, touch screen on every patient's room if you want to have, how do you have the same information accessible seamlessly, right? We help customers in all of these areas, right, in terms of having a single usage across all of these different devices and provide a continuous health care. Now this is more of a workflow rather than a technology in itself, because technology is just an enabler, as you would always see. This is workflow, and how do you integrate these different components and different processes, how do you put them into a clinical workflow so that as the patient comes in to the time the patient leaves, how are they interconnected, right? How are you able to move the patient throughout? It could even get insights like patient 360 degree, you might have heard of this term, where you are able to see this particular patient and how his relatives, his or her relatives, and how are their circle of people having a similar impact, for example, or similar disease, for example, and how do you ensure that the treatment that is offered is in the right way and right path to help them cure better. EMR Anywhere, electronic medical records, this is not something new, but anywhere and anytime is the most critical part. As I was talking about, the increase in the way of diagnosis. So X-rays, for example, used to do a certain amount of data in about say 50 MB. CT could be maybe about 300 MB, right? Now MRI could be much, much bigger, right? So how do you seamlessly move this data whenever the radiologist or a clinician wants to access this to get better insight out of it? Now there are remote radiologists that is an evolving trend today, where radiologist is not necessarily present next to the patient while this is happening, right? You are able to still do a better job, right? And for example, you want to use the data to refer to a peer and ask for opinion. You want to talk to somebody who is based out of say US, a specialist, and you still want to be able to get his insight while the data set is really, really huge. The data could be anywhere. It could be on a on-premises setup, it could be on a public cloud, it could be on a private cloud, it could be anywhere. How do you ensure that this data movement is able to handle the network latencies, at the same time is able to take care of the complexity that happens between different vendors who are part of this typical say PAC system itself? If you look at, there are different PACS vendors, and each of their systems are unique. They don't talk to each other, right? These unique information, how do you make it talk to each other, right? VNA is one such common phase which is typically used to be able to provide one unified medical imaging solution. This could be a very simple start for what you have to achieve in terms of a completely connected healthcare. This allows you to see information from different OEMs, different radiology, even pathology and cardiology, and different PAC systems to be able to unite and have one single view. That gives you much more capabilities to be able to, for example, if I as a patient have come in and I have done an X-ray some time back, today I have come in to do some say MRI. So as a hospital, you are able to see that there is a relation and there is something that you can derive out of these two particular episodes that have happened, right? Now extend that to much more capabilities that you can bring in. This data, how do I tie it together to be able to see the patient's relationship and the effectiveness of this particular treatment in other similar age group people, right? So AI can be a really helping hand in solving these challenges and providing a better care to the patients. So what is Dell helping you do here? One, Dell can be an essential infrastructure provider to help you get to this path without the complexity of it, right? So many a times technology is looked at as a complex and a burden which typically is difficult for an organization which is not focused on IT to handle it, right? So you want to have this as a service. You don't want to know anything about what is inside. All you are bothered about is about taking imaging, for example, right? You just want to pay how many images in a month, and those many images is all that you would care about, and that is the charge you want to pay. You don't worry about what is behind in terms of the infrastructure to support all of these things. It could be research for pharma companies. You don't want to own the equipment, you don't want to manage the IT infrastructure and the technologies that are there. Research as a service, AI as a service, right? Or HPCs as a service. Again, this could be in drug discovery, in clinical trials. There are many, many areas. Again, these are a very limited number of use cases I have mentioned, but as a service is something which a lot of our customers have been benefiting from. And this is an area where you focus on the primary focus area of your organization, which is to provide patient care, and forget about the technical jargons and all the complexity with respect to infrastructure, the lifecycle management of it, security of it, and all of those things, right? We can deliver it as a service to you. Or the second option is you want to consume it like a typical IT infrastructure, right? Where you are bringing in different workloads, and the IT infrastructure can be procured as a CAPEX or an OPEX, right? Again, that is another area which we can work with you in, say, EMR, in PACS, in case of cloud, multi-cloud solutions that are there. And connected workforce is another area where we are seeing today with the virtual health, again, is an area. There are customers who have come back to us and said, we don't have a data center, we don't have a real estate to build a data center, but we don't want to go to a public cloud because the data set is so huge, and sending data to the cloud and bringing it back, etc., is quite expensive and latency sensitive as well. So we have an offering for them where you are able to do this just like a normal rack, just like any place. Like it could be standing like this as a stand behind your reception. You don't have to build a data center for this. This rack in itself is a data center. So this have all the IT equipments, power, cooling, controlled environment that is required, all of them available within this, right? This helps you eliminate the brick and mortar data center, which typically takes time, blocks space and everything. You can do this as an immediate or a quick solution for your requirements. And something that we have launched last year around May is on-demand, technology on demand. This is any infrastructure that Dell sells today, be it endpoint devices to the enterprise data center solutions that includes server storage, hyperconverged platforms, data protection, DR, everything. You can consume all of them as a pay-as-you-go, pay-as-you-use kind of technology. This way, you don't have the initial capital expense that you have to put in for buying this equipment. So this is with the 12 months or a 36 months or a 60-month kind of a contract that we can offer you, and thereby you can consume these technologies and pay only for what you use. You don't have to upfront lock your resources in this. So as such, Dell Technologies, a lot of people might not be aware, Dell Technologies is not just offering PCs and laptops, right? That is one of the end devices that possibly comes somewhere in this space of connected health, connected workforce. But we are working very closely with a lot of health care providers throughout the industry around the world in helping them handle technology complexities, right? Right from multi-cloud infrastructure to healthcare IT modernization part of it, and all of the EMR and medical imaging solutions that work around. Especially in the personalized health, we have been, I'm sure all of you have heard of digital twins, right? We have been building digital twins for patients, right? So that before a drug can be put on that particular individual, you can use it, test it on a digital twin to see the reactions of it, right? You can also use it to personalize the treatment for this, because today most of you might be aware that drugs that are created are generic drugs and is expected to work on everybody 90%, 95% efficacy, right? But how sure are you it will work on that particular individual? How can you increase that, right? There are a lot of these actions that happen around precision diagnostics and clinical genomics space as well, where we have been helping a lot of these industry veterans in helping solve those areas. Virtual health is an area which today, because of pandemic, things have been increasing, where even in the morning discussion there was talk about, we don't want to come to the hospital to get care. We want to be at home. We still want to be able to get the same amount, better treatment, right? So being at home and being able to provide the care for them, track them on the vitals, the data that goes in, and the medication that they are taking, and a nurse visits once in a day or once in probably a week's time, and take care of all of those needs, requirements there. And telehealth from a remote or a rural areas, how do you connect them, right? Those technologies to help all of those is again part of what Dell technologies offer, along with all the security. That is definitely the fundamental requirement where your data is in the most secure place, from a cyber recovery, from a protection against any of those wrong hands from touching those data. So as such, Dell Technologies worldwide, we are present in over 10,000 plus hospitals. We are providing infrastructure for all of those. You are seeing the numbers on the board, but as I mentioned in the beginning, so in India itself, if you look at, we have been very closely working with the Ministry of Health and Family Welfare in the NCD program, and we have touched over 160 million lives as of last March to 3 months back. 160 million people have been benefited out of this, and we have been able to help address, eliminate the chances of non-communicable diseases impacting the life and I would say it's not just impacting the life of one person there, but the entire family as well, right? Because they are dependent on that particular individual. So we have been able to work very closely with Tata Trust and Ministry of Health and Family Welfare, and have been delivering the solution platform for them, and we continue to do that. And this is something which if you look at the complexity, the ASHA workers, I'm sure all of you are familiar with the education level of those people. How do we ensure this platform that you're building is so easy to use, right? And many of the places they reach do not have any connectivity. They take it on a tablet, for example, and when they come back to a particular location where there is connectivity, the data gets synchronized with the cloud. And from there, the clinicians have a view of it, and then they take the course of action for that. This is my last slide. So I just want to thank you for your patient hearing. And this information, and we are around, we have a booth as well. So in case if you are interested in any of these to talk deeper about it, we are there. Please come through. Thank you so much. Thank you.
Very enlightening discussion, and you touched upon concepts like digital twins and things like HPC as a service and AI as a service, and how Dell is operating from edge to core to cloud. So a small token, Sugumar, can you just be here a little bit? May I call Shobhik to hand over a small token of appreciation for Sugumar?